My name is Carla Demergent, and for this presentation, I chose the topic of cervical cancer. So, cervical cancer actually results from an STI called HPV, or the human papillomavirus, and it's due to this that cervical cancer differs from other sorts of cancer in that most often it develops as a result of this HPV, this human papillomavirus. The thing with HPV is it is dormant in males, so oftentimes women do not even know that they've been exposed to it, as the man has no symptoms, and the man also probably does not know that he has the virus. And this HPV in the body leads to cervical cells turning into cancerous cells. Don't get me wrong, environment also plays a role as well, whether or not you smoke, your habits, and things like this. Um, but the thing with cervical cancer is that symptoms oftentimes do not present themselves early on. And once the symptoms do present themselves, it's often too late to reverse the cancer. And some risks for cervical cancer include early sexual activity, multiple sexual partners, and other STIs such as chlamydia and gonorrhea, which could increase the risk of contracting HPV. Here there's a little figure from one of the papers in my references. It's the progression of a healthy cervix into a cancerous cervix. So as you can see here, it starts as a normal cervix, and upon infection with HPV, it starts to become a little bit more, as you can see, there's like a sore there in the cervix, and then it progresses into a precancerous lesion with precancerous cervical cells, and then it becomes full-on cancer, as you can see in the very right. Can I use my mouse? Yes, as you can see here in the very right. And it says, it basically just describes the progression in this little summary here under the figure. So basically, in solving this public health problem, two things that I would say. Currently, they do offer the HPV vaccine. Personally, me myself, I have received the vaccine and I recommend it to all of my friends and family because once you get it, you have it for life. And so, in the off chance that, God forbid, you were to develop it later on in life, you are protected once you get that HPV vaccine, which is a series of 3 vaccines. You get one vaccine and then you wait another month, get the second vaccine, and then the third vaccine is administered 6 months after the second vaccine. So, a couple things that I would like to suggest as public health approaches and strategies are developing high school programs designed to inform the youth about the dangers of HPV, how it leads to cervical cancer. Oftentimes, the high school programs that are in place warn against the risk of pregnancy and STIs such as chlamydia, gonorrhea, syphilis, things like this. But HPV is not widely talked about, and its prevalence and the way that it leads to cervical cancer is something that more young women need to learn about. And so, um, teaching this in high schools or regular doctor's appointments, having the doctor speak to the young girls about this, I think would definitely help. As well as mandating the HPV vaccine for all adolescent girls, regardless of whether they're active or not. Because as of right now, it is an option. You can opt out if you'd like to. But I believe that a good public health approach would be to make it mandatory for all adolescent girls, especially since the most at risk group of women are between the ages of 18 and 25. So essentially, there's the only types of really the cancer that is able to be treated is when it's in stage 1, because as it progresses, um, it really becomes untreatable, as many cancers do. The earlier you catch it, the better. So, stage 1A cervical cancer refers to the type of cancer that is so small it's only visible under a microscope. And this is effectively treated with hysterectomies, which is removing a portion of the uterus, but still leaving the uterus kind of more, I don't know how to say this, kind of more like inside the woman, leaving that intact, taking out the like external portion of the uterus to try to get rid of the cancer. And once this is done, less than 5% of women have reoccurrence of this cancer. So this is a very effective method in stage 1A of the cervical cancer. Stage 1B is when it can be seen and felt upon a physical examination, not only under a microscope. So it is a little bit bigger. So stage 1B is most commonly treated by using all chemotherapy, radiation, and surgery all together in an effort to try to eradicate the cancer. But this will only cure about 70 to 75% of patients and prevent a reoccurrence as well. Because, again, as I said, the more it progresses, the less likely it is to be treatable. So throughout history, this is the way that it's been treated. Since there is no definitive cure for cancer as of right now, it still prevails in many parts of the world. As for public health in the future, I believe that an basically an extrafascial hysterectomy combined with radiation showed extremely low likelihood of cancer reoccurrence in patients, followed across a span of 10 years. And this was pulled directly from one of the scientific articles that I discovered. It's curable when caught early on, so that emphasizes the importance of annual pap smears and contraception during intercourse. So the big thing with cervical cancer is it can be almost completely preventable as long as you don't contract HPV and you use contraception, because it does result it does present itself as a result of sexually transmitted infections. And in my opinion, more attention has to be brought to the dangers of HPV, um, because it is such a strong factor in developing cervical cancer. And so, as I said before, I feel that the HPV vaccine should be mandatory for all adolescent females, and the programs must be put into place to educate young girls and their parents, because especially their parents, it's important to know that getting the vaccine at such a young age will protect them for life. So it is extremely important. And these are my references. So thank you so much for listening.